Hi, Dr. Scott Freed, the doctor in the house. I'd like to talk to you today about the Carpal Cure, our heat moldable, customizable brace that can allow you relief from carpal tunnel, nerve problems, ligament injuries, tendonitis, and arthritis in your hand and wrist with its patented and clinically proven night rest for arthritis and tendonitis. As a hand surgeon, I'm very particular about how my patients are protected after surgery and when I am treating them for injuries, such as ligament injuries, carpal tunnel, or tendonitis, or tennis elbow, and the like. Braces have by nature, over the course of time, been fairly standardized at the wrist and hand. And this is good and bad. If you have a fracture or a broken bone that needs complete immobilization and no motion, probably doesn't matter much what brace you're in as long as it is holding it in position. But for most problems, for most injuries, such as we're talking about, for most patients who are recovering from a surgery, and especially for patients with problems like carpal tunnel, nerve injury, tendonitis, and the like, rigid immobilization and immobilization in the standard cock-up position is actually wrong. The literature says it's wrong, and not only doesn't it work, but it creates stiffness and immobility, and it doesn't allow the structures to slide the way they should or move through the tissues. I've talked in other videos about carpal tunnel nerve injuries and how the scarring about a nerve, if it gets fixed about the nerve, actually has ongoing problems for the patient, ongoing pain and discomfort. So protected motion in what we call dynamic splints is very important. And that is what is key in our braces. Our braces protect motion, but at the same time protect the ligaments, tendons, and nerves. So by allowing some movement, it allows the inflammation to calm down, but also you to live your life and not be inhibited completely by a brace. And these braces are very different. They fit differently, they look different. The braces we use were designed by my therapist and myself as we worked with patients over the past 30 years, making custom devices, custom splints, and the doctor in the house wrist braces are a result of what we've created, which can only be gotten by a custom basis in our therapy unit or through us. It's very different, and I'd like to show you these braces right now and how they are used and how they might help you. All of the braces in the Doctor in the House line have inside of them orthoplast panels. These panels are a plastic orthoplast, and it's bendable and moldable. It's fairly rigid, it's fairly stiff, but it fits inside these pouches in the brace. And there are actually more than one inside. There are some in the bottom here as well. And the nice thing is, by leaving in or removing some or all of these, you can have more or less rigidity to the brace, more or less motion. And you can take them out and according to what your medical problem is or how it feels to you, have more or less pieces in. But you can see the brace does allow some motion, and it's purposely made to be open on the top. The important part of the arm to stabilize is the volar or palm side of the wrist, only up to about here coming around. So by putting this brace on, just slipping the hand in, placing the thumb inside, you can see as I put this brace on myself, just 3 straps, and the brace is open on the top. It's open on the top. It allows my thumb nice freedom, but the support is all coming from here on the palm side. And specifically, this brace is designed in layers, which allow heat and a massaging to occur to the tissues as you move. And this is protected motion. This is the dynamic portion. You're able to live your life, key at a keyboard, play a musical instrument. You're able to use the hand, do a handstand if you want. It will still protect and give your arm and forearm protection. It doesn't need to be circumferential or all the way around the arm. In fact, the opening on the top and the back is important. When using this device, when using these type braces, my patients can live their daily activities, but yet be supported in a kinder, gentler way. You can see the wrist can be cocked back or it can be molded to wrist neutral. These orthoplast pieces, the inserts in the brace, are heat moldable. So the entire brace can be placed in a microwave oven for 30 to 60 seconds, and then you place the brace on your arm and rest it on a flat surface. You rest it in the position of wrist neutral in most cases, and then allow that to mold to you for 60 seconds. You have then a customized brace that is custom molded to you specifically for your needs. There is also another piece that can be inserted in the brace, and it goes in that pocket I just showed you. And this is the night piece, or the T-piece as I call it sometimes. It's for night rest of the fingers. If you have arthritis, tendinitis, problems with the fingers, or if you just want to rest from a trigger finger or a finger that gets locked down, you can just basically insert this at nighttime right in the brace, and the fingers are protected. Again, this is a dynamic piece, and it's made so that you have some motion here, but the fingers rest. They're calm, and this again can be molded. This piece can be heat molded again to conform to the fingers, or just include one, two, or a few of the fingers. So it is another component of the brace that some of my patients will use to help calm down tendinitis, arthritis of the fingers, and the like. They're easy to use, customizable, heat moldable, and help heal you without surgery, or help you heal better after surgery or injury.